our high blood pressure readings. The normal reading for high blood pressure is the normal rating for the high blood pressure is 120/80 or 83. When you have such a reading, it's okay, it's normal. 120/83 is okay. But when it's the mild hypertension, what your reading is going to be like 140/160/90/100. 140/160/90/100 is mild. And when it's mild, you have to watch out. You have to be on top of it, checking it to make sure it doesn't go out of hand. Then the number 3 is when it's moderate. When your hypertension is moderate, that means that your reading will be 160/200 over 100/120. That means it's a moderate, that period. You still have to watch out. And I know that by this reading, you should be taking your medication. You might have seen your doctor, and the doctor might have placed you on the high blood pressure medications. Then the severe one is when your blood pressure reading is above 200, over 200, or over 240. But I want us to bear it in mind that when your diagnostic, that's the bottom one, when it's much higher than this 83, 84, 85 to 100 or above 100, that is more dangerous. Let's take for instance, if you go to the hospital and the doctor told you that your reading is 130/100. Don't just celebrate and think that 130 is a good number. Yes, 130 is a good number. But what about the 100? The bottom line that is saying 100, that is danger for you. Don't just go home and relax. They have to give you some medication to make sure that bottom line comes, to normal. The normal, as I said earlier, is between 80 to 83. So when your bottom line is more than that 83, my dear, something is not right. And how do we check this, our blood pressure? This is the cup I'm using to check my blood pressure. The right hand for you to use to check your blood pressure is your left hand. But if for any reason you cannot use your left hand, use your right. Like me, I'm using my right. I'm using my right because I have a fistula. Fistula where I'm getting dialysis for my kidney failure on the left. So I can't use that left for any test. So that's why I'm using my right. But they are equal, right is equally good. Yeah, I have 169/92 and my pulse is 72. I think we can see it here. So this is my reading. And remember that mine is the severe one. I'm on medications for this. So that is it. It's good you know how to get your readings. And you keep recording them. If you're already diabetic, you keep your record so that when you're going to see your doctor, you'll be able to show them, say this is what your reading have been, maybe for the past 2 weeks, so that they'll be able to know how your reading is. And if you are checking your reading at a particular time and it's still not right to you, change that time. If you've been checking it like 8 a.m. in the morning, you can take it like 10 or 11. Change the time that you're checking it, so that what matters is that you get the accurate result. And one other thing that is worthy of knowing at this particular time is that when you have a low blood pressure, low blood pressure is more dangerous than high blood pressure. And when you have low blood pressure, you can start fainting, you can start feeling dizzy, you can start having blood on your eye, you won't see very well. So those are the signs that my blood pressure is very low. And what do you do at that junction? You drink water. take some liquid. If you have alligator pepper, you can take and try to maybe walk around, just around this little vicinity, just small spacing, small walk. So thank you for following us, and keep following us for more. And please, if you like what we are doing, just follow us, subscribe to our YouTube, and God bless you. Thank you.